Epilepsy is a common brain disease that affects about 1 in 100 people. People of any age can have epilepsy. The primary symptom of epilepsy is the occurrence of seizures, brief electrical storms within the brain. When a seizure occurs, the part of the brain affected cannot function as it normally would. This may result in loss of consciousness, convulsions. There are many challenges facing people with epilepsy. Getting an accurate diagnosis can often take months or even years, as can matching a patient to the right medication for them. For about 30% of patients, their seizures cannot be controlled by any of the current available medicines, and there is no cure for epilepsy. The idea of the EpimiRNA research program is to focus on the inside operation of brain cells. Normal brain function depends on brain cells making just the right amount of thousands of different types of proteins. Making sure the levels of all these proteins are correct is an immensely complex job. If it goes wrong, then the brain can get too excitable and seizures can result. It turns out the brain has a number of ways to make sure protein levels stay in the right range. Some small molecules may have a big part to play in it. MicroRNA. These are like the conductor of the protein orchestra. MicroRNA sticks onto the messages sent from the cell's design blueprints, DNA, that instruct the rest of the cell which proteins to make and how much of each to make. MicroRNAs ensure that just the right amount of protein is made in a cell. In the case of epilepsy, levels of some microRNAs are altered in the brain of a patient. This line of research has proven successful. The teams involved in the EpimiRNA project have discovered a number of new microRNAs that control brain excitability. They have shown, using experimental models, that targeting these can reduce seizures. The teams have also discovered a set of microRNAs in the blood and brain fluid that are different in people with epilepsy. They are now working on a technology that might help a doctor quickly and simply measure the levels in a hospital or other setting to help decide whether or not a patient has epilepsy. The researchers hope, through their collection of brain and blood samples, that further discoveries can be made. By working with a number of European companies, the project has also led to some new commercial opportunities, including a spin-out company, a medical device for recording and testing brain function, and drug development program to create drugs of the future. EpimiRNA has already resulted in a number of important results, raising hopes for people suffering from epilepsy, and there is more on the way.